If we could take our seats, we can have the last panel of the day. So the last panel today will be moderated by Ruth Parker. This panel will function in the same fashion as we did with our first panel. The questions will be posed, and each panelist will be asked to respond. And as I said, Ruth Parker will moderate those responses. Ruth, as you know, is Professor of Medicine and Public Health at Emory University School of Medicine. And Dr. Parker will then introduce each of the panelists individually. Ruth?
Okay, great. So where's the beer? So that would be the first question, right? So I will assume it's coming. And in the meantime, welcome to the last session. This should be a good discussion. We get to go on top of a lot of other great presenters and some great content that's been presented. So my personal thanks to everybody who's gone before us and given us a lot to think about and for us to try to put a little bit of cohesion to before we hear from you all. I'm impressed with a lot of the questions that we're getting from the audience, and I did, when people caught me in between, I said, what's your question, to see if anybody had any burning questions from the floor before we start. So we will definitely be looking for those, and I'm assuming there's some people who've got some good questions that they want to pose to the group as well. We have a few that we came up with on the front end, and we'll use those to get the conversation started. But as you come up with burning questions, know that we want to hear from you. So let's try to make this something that is fun and interactive. So let me introduce my new friends here and welcome them. Dr. Kara James is the Director of the Office of Minority Health at the Centers for Medicare and Medicaid Services. The mission of the office is to improve minority health, reduce health disparities, and to foster health equity. Next to her is Laura Morris. Laura is the Assistant Healthcare Advocate in the Office of the Healthcare Advocate for the State of Connecticut. Her office assists consumers with healthcare and healthcare coverage issues. Next to her, we have our own very dear Kim Parson. In her current role in the Corporate Consumer Experience Center of Excellence, she's part of a collaborative to define the desired Humana consumer experience. And then next to her is Mila Kaufman. She is the Executive Director of the Washington, D.C. Health Benefit Exchange Authority, the mission of which is to implement a health care exchange program in D.C. So welcome to you all. Thank you for being here. That's but a very small portion of what you do. Lila, do we want to use the questions or not? You may just, yeah, we do. Okay. So we'll start with, boom, there they are. So I am going to ask each of them, if they will, to sort of take the question that's there posed in front of you. If you choose not to do lessons and opportunities, I'm going to ask you at least to take a look at that. And based on what you've heard today, based on the focus of the Health Literacy Roundtable and the whole notion of health insurance literacy and the way we've looked at it today, I'll ask you to start, Kara. What do you want to underscore as the big opportunities? There are a lot of them, but give us a couple of the ones that are burning from where you sit.
Okay, so thank you for having me here today. It's great to be here. In addition to directing the Office of Minority Health, one of the things that we've been working on is from coverage to care, really helping consumers understand their coverage and be able to connect to particularly primary care and preventive services. And I think that there have been so many lessons and opportunities. You've heard how HHS has evolved its efforts over the past couple of years and how we continue to do so from the learnings. I think one of the lessons and opportunities that relates very much to that in-person assistance that particularly some of our minority communities are looking for and find very beneficial. One of the lessons and opportunities is really just the value of partnership. And I think at HHS we've gotten better in doing that, engaging our partners earlier in the processes. So you've heard about, feedback on the notices and notifications. How do we engage? What resources and tools that we can develop? How do we support those who are reaching out and engaging with the consumers to enroll them, our assisters? What do they need to be able to do the process better? So that's one, I think, both lesson and opportunity of how we can continue to support those activities. I think, the successes we have seen, particularly the number of people who have gotten coverage is a success. We're starting to see more people using it. I think we still have a lot of opportunities and lessons there. A lot of people fearful, you've heard, about using their coverage because they don't know how much it's going to cost them. So how do we help to make those sorts of information more accessible and more understandable? I think, the navigation, the complication and fragmentation of our healthcare system makes that a challenge for us. But within the confines of what we have, I think there are a lot of opportunities for us to do that better. So I'm going to stop. I could go on.
Good. No, that's good. That's good. Laura.
Hi, thank you for having me. I'm glad to be here. Just a few things about our agency if people don't know. So we are a consumer assistance program. We're a state agency. We're a standalone agency. We have 19 people in our office. We really have a threefold approach to our mission, which is one, to educate people about the rights and responsibilities under their health insurance plan. The second is to help them when they have a problem. So whether it's they're being denied a service or a treatment, we help them get that covered, whether it's through an appeal or billing and coding issues, whatever the issue may be. And then third is legislative and regulatory action. So anytime there's any new legislation in Connecticut regarding health insurance, we're there monitoring that. And then if we do see any issues going on with the carriers in Connecticut, we may need to go to their regulatory bodies and ask them to step in and regulate. So sitting from where we are, there was a lot of overlapping themes that I've heard here today. I think the biggest one was the importance of having that in-person assister help with not only enrollment, but now education and understanding their plans, how to utilize their plans to the best of their benefit. But I think one of the areas that's lacking is how do we continue funding that? I mean, there were other underlying themes, but I think that was the biggest one for me.
Hi, okay, thank you. Yeah, to build on, because I heard the same things that you all have already mentioned, so just to build on that, what I would say is we heard that navigators are not just necessary when you're selecting the plan, right? But as you start to use that plan. Because when you're selecting your plan, and a lot of times you don't know what you don't know, right? So I'll give you a couple of examples. My son was diagnosed with ADHD. Well, this was in the middle of my plan year, and because he hadn't had that previously, or we didn't know about it previously, when I selected my plan, I wasn't concerned about what ADHD medicine was in which part of the formulary, right? And so that was a surprise experience for me when I got ready to use my benefits after I'd received a diagnosis, right? That the prescription that they were looking to put my child on was going to be in the highest formulary tier, right? So there's no way to plan for that when you're selecting your benefits. You don't know what you don't know, right? So I think when we're thinking about navigators and how they can be helpful, it's throughout the process, right? You really need someone to be able to walk with you throughout this. And this is whether you've had insurance all of your life or whether you're new to it, right? As another piece of that is as we know, when you're navigating health, if you're sick, that can cause problems, cognitive problems, your abilities to be able to make decisions about these things as well. So, one of the themes I heard was the importance of help and navigation continuing throughout the process. And I think that partnerships is a key way to getting to that, because when you're talking about, we lost the funding for that, right? Well, it can't just all come from government funding.
afternoon. Are you all awake? Great. I have to say, this is the toughest panel. We're the closers, and we know we stand between that beer, wine, seltzer. So we are the last, and hopefully it'll be worth it for all of you who are still here. I very much appreciate being invited. I think I'm the token representative of state-based marketplaces here. Okay, so you have to be on best behavior with me. I'm very proud that in DC we have a state-based marketplace. It's called DC HealthLink. My team and I are responsible for it. DC was the last state to start building our online IT system. And the good news is that we were one of 4 states that opened for business on time, October 1st, 2013. And we actually stayed open all day. And we opened for group and individual, and we were also designated as a source of coverage for Congress. So we have members of Congress and their staff, including their district offices. I'm proud to serve all of my customers. But one of the lessons for us that first year was we were so laser focused on the technology and focusing on the core functions, building a system that has never existed before. Imagine instant eligibility for Medicaid or private coverage. It's quite remarkable. There was no roadmap. We focused, but the price we paid was that we didn't focus enough on customers, what they needed, the kind of tools they needed at the front end to make good decisions, and the kind of support they need once they have that health insurance card, right? Because it's great to have that health insurance card. It's supposed to give you that financial protection that we heard discussed earlier, hoping you'll stay out of bankruptcy. But it also is supposed to give you access to medical care, right? That's the whole purpose of health coverage. So we focused so much on IT that there just wasn't enough energy left, air in the room to focus on everything else. So we learned that. And the good news is that in learning from some of your research, which I so appreciate, and learning from our assisters and navigators and other folks on the ground, what works, what doesn't, we have been able to implement some critical decision support tools. In fact, we are one of the states, and DC is a state if you live here. We just need the right to vote. We added consumer textbooks plan match tool at the front end to help our customers make better decisions. This year we offer 26 different health insurance products on the individual side, 136 different products on the small group side. I don't think there's a single person in this room who has the time to look at all the products. So the consumer checkbook tool that we've been using for our customers that know about it and use it, it's 5 stars. We also have an all-plan doctor directory that also makes it easier for our customers at the front end. What we haven't done well, and that's why I'm so excited that I got to spend the whole day here taking a lot of notes on each panel, is what happens afterwards. What do we need to do now? So as a follow-up to this, I would love the opportunity for you to provide me with more information about your research and how I can implement it in DC to help my customers make better decisions and to understand how to use their health coverage. And the second big lesson is we would not be successful, and I'll say that again in case you were asleep or zoned out or checking your mobile device. We would not be successful if it was not for our navigators and our in-person assisters and our certified application counselors. They are the ones, they are the army on the ground. One of the things we've learned is technology is great if you use it, if you like it, right? It's worthless, really, for people who don't use it. For people in all ages, we have 20-some-year-olds aging off their parents' policy who are savvy technology users in every aspect of their life, they are afraid to make a decision such as which health insurance policy is best for them without talking to someone in person for that advice. And that in-person person they need to talk to is a trusted voice who they can relate to, a peer who they can trust to base their decision on. So without the in-person help, every year we would not be successful. And so for future opportunities to even expand the role of in-person help and assistance, I really encourage all of you in your individual capacities to figure out ways that we can provide additional funding for the groups on the ground who are really doing this where the rubber hits the road work. We cannot exist without that.
Yes,
So waiting to see if anybody else said, I think two quick things. One, picking up on a comment that Winston made about, the young and invincible and the old and decrepit. One of the lessons in the
The
opportunity.
old Vincibles.
Old Vincibles.
OVs, yeah.
Yes.
Well,
yeah.
dignified a little.
Okay, well, I just repeating what he
Come on
said. I like the over 35. 'Cause but I think, one of the lessons and the opportunities there is that, particularly when putting the coverage to care hat on,